Hi, I'm Dr. Richard Ruhling, here to share with you on the title, Be Your Own Doctor Without Prescription Drugs and Give Yourself a 30-Year Advantage with Real Health Care. I'm an MD physician. I actually took internal medicine and was board certified, had a year of cardiology before teaching health science at Loma Linda University. And while there, I had some experiences that helped me get a background for what I'm to share with you here. But the four things that I want you to take from this brief talk, number one is that medical care is now a leading cause of death, number one really, made so by prescription drugs. And that number two, the 7 simple health habits that Dr. Breslow at UCLA discovered were good for a 30-year advantage. Number three, the father of medicine, Hippocrates, said, let your food be your medicine. And number four, medicine today is no longer looking to the father of medicine, Hippocrates. They are a bastard son of DuPont, which says better living through chemistry. It's for economic reasons, but bottom line is it's a dangerous area to go for health and even for disease. So with that brief introduction, I'd like to share a personal experience with you. My wife, Norma, got a bladder infection. All the symptoms, burning and urination, went to her doctor to see what she could do, and he prescribed an antibiotic, which many of the listeners to this video might identify with, having possibly taken it. She took it just as prescribed for a couple, 3 days. It cured the infection, and she stopped it. But some months later, she developed a spots under her skin, and she went to see her doctor again, who did a blood test, and he called urgently the next morning, wanting her to see a hematologist. The hematologist admitted her to the hospital, did a bone marrow exam, and then she had an operation, a splenectomy. She was treated with high steroids, gamma globulin, in and out of hospitals for a couple, 3 months with multiple transfusions. And I can recall an evening in October when we were playing Scrabble that evening, her favorite game, but didn't feel well. She wanted to go to bed. And in the night, she seemed confused, called from the bathroom, didn't know where she was. I helped her back to bed, and she was lapsing into a coma, in which within the 24 hours she actually died. The her doctor signed her out as idiopathic, which means that we don't know the cause for this lack of platelets in her blood. But I was taught in internal medicine training that idiopathic means idiotic on the part of the physician and pathetic on the part of the patient. And I looked in the physician's desk reference for the medication that she had taken for her bladder infection, and sure enough, under listing as an adverse reaction, low platelets or platelet disorders were identified, and this was the only medication she had taken before the onset of her illness. So I was upset, angry, went to see an attorney. Unfortunately, the Congress and the Supreme Court have sewed things up to protect these drug companies so that you cannot really sue them easily. And so bottom line, I did go to visit senators. I went through the U.S. Senate office buildings with medical literature to show that prescription drugs are the #1 cause of illness, disability, and death. I'll cite them briefly to you. The JAMA, Journal of American Medical Association, published in 1998 on tax day, April 15, showed that reported 106,000 deaths in hospitals from adverse drug reactions. And the definition of an adverse drug reaction is a drug properly prescribed and administered. It's not malpractice. The doctor didn't prescribe the wrong medicine, and the patient did take it correctly, but people just react adversely, strangely, unpredictably so. And that sounds not too worrisome, 106,000 out of millions living in America. But 2 years later, the Western Journal of Medicine published another article, report of outside the hospital. The first one was in hospitals, Now outside the hospital, 199,000 dying from adverse drug events. Well, that together makes it 305, and now medical care is the number 3 cause of death with these two items put together. And that was 20 years ago on data older than 20 years. But in 2007, the Archives of Internal Medicine in September 7 or 10 reported the deaths from adverse drug events increased 2.7-fold in a 7-year period from 1998 through 2005. Now that's huge, because if you take the 305,000 that we're talking about and you multiply it times 2.7, you now have about 825,000 deaths, which is well above the current deaths from heart disease in America or cancer. So number one is the leading cause of death is adverse drug events, and the article from the Western Journal of Medicine showed that for every death there are 550 patients seeing their doctor for help with their bad reaction because they feel ill or sick in some way. And so that is similar to a 1/3 of the U.S. population. A lot of people getting sick, seeing their doctor, and for every patient who dies, there are 40 that go into the hospital to have tests, find out what's going on. They don't all die, but bottom line, then 15 are admitted to nursing homes, extended care facilities. These people are probably messed up for life, disabled. And on this topic, we can take a quick look at how people end in nursing homes. Now, medical literature shows that 2/3 of people who die from heart disease are in nursing homes. They're over 75. I shouldn't say they're in nursing homes, but they're over 75, and many of them are admitted to nursing home. When you get over 75, that's a typical place to go for end of life. And these people are sometimes so spaced out on medicine that they can stand in the hallway and stare into space, blank look, filling their diaper. You ask them how things are, oh, fine. But bottom line, no brain, no pain. It's a sad situation, and I don't want to go that way. I just say that I want to contrast it with Dr. Cooper, Ken Cooper, who got America jogging, wrote the book Aerobics, and he related in a conference or convention that I attended in Chattanooga area that his mother around in the early 90s was not feeling too well, but she did go out for her usual exercise on a Friday. Over the weekend, felt a little worse, and on Monday she died. Now, contrast that with a nursing home where custodial care, all that you might want, but spaced out on medicines. The average number of prescriptions in nursing homes is 9 to 13. Hello, you know, and we say they died of heart disease. You know, we've just been discussing medical literature and how that a drug can kill you or make you sick. And if the average number of prescriptions is 9 to 13, when the doctor signs their death certificate from the nursing home and they don't want to do an autopsy, and who wants to find out that your medication killed them, your prescription, they sign out heart disease. They died of heart. The heart stopped, of course. But bottom line, I would say that drug reactions are much bigger than we are looking at, poorly reported by physicians and poorly reported in their literature. Okay, because what I've just given you is a huge clue for a big problem. And we should really get back to Hippocrates, who said, let your food be your medicine. 7 Simple Health Habits by Breslow were good for a 30-year advantage in a federally funded study in Alameda County, Los Angeles area. One of the remedies was exercise. If you got it 3 times a week, half hour of pretty good exercise, that would substantially increase your life expectancy. And the big 3 that were really problems were smoking, drinking, and obesity, of course. But the others might be summarized by the acronym New START, which is nutrition, exercise, water, sunlight, temperance, which means no drinking, and I would extend it to include, see, alcohol is the oldest drug in existence, but now we got prescription drugs. And we're just saying that's a problem too. Avoidance of that would be a significant benefit. And air, pure air, not smoking, rest, 7 to 8 hours sleep a night is ideal or optimum. And T for trust, happy attitudes. In Breslow study, he asked the people, are you happy? And if we're happy, we can use the natural remedies, trust in God, just like our money says, and be better off. But modern medicine does not have much of a focus on these remedies. When I took my internal medicine training, I don't ever remember much of an emphasis on health. It was on disease, diagnosis and treatment of disease. Healthcare is not medical care, and medical care is not healthcare. It's the care of disease, diagnosis and treatment. So there's really an inverse relationship. The more people take prescription drugs, the worse their health gets, actually. One of my worst nightmares when I used to work emergency room was a little old lady with a bag of pills, because you surely didn't know what was causing her problem. You would treat her symptoms and have her go back to see her doctor soon. So that being the case, I would like to appeal to people on this video to consider real health care, not medical care at all, but the 7 simple health habits that we've enumerated from the New Start concept. That's you can see it right here. These are CDs which have a discussion by leading physicians. There are some really good, fine physicians, alphabetically. A for Ammon on brain, B for Barnard on diabetes, C for Colin Campbell on the China study and cancer, showing how you can turn it on and turn it off with diet. And I use D for Greger. Greger is really great, covers a wide range of diseases. E for Esselstyn on heart, and F for Furman, he's excellent also. These are good guys, along with my own focus on the New Start remedies, which help break any addiction and help you to focus on any ailment you might have. So this is just a brief look. You can go to my website, richardruhling.com, and get more information. Thank you for considering this. In summary now, leading cause of death is prescription drugs. We can extend our life 30 years with the 7 simple health habits represented by the New Start acronym: nutrition, exercise, water, etc. And food is our best medicine, according to the father of medicine. Sadly, medicine today is using DuPont's slogan, better living through chemistry, but it doesn't work well for the body. It works fine for nylon, tires, and carpets, but not for the human body, which does not recognize drugs and chemicals as food does. Thank you very much. God bless you, and look forward to seeing you again.